What's up, everybody? My name is Sam. I'm a certified medical massage practitioner, and I was born legally blind. And today I'm going to show you how to do a clinical body work for neck, shoulders, and back using your somatosensory system or your sense of touch to help treat some of these issues. First, we're going to start off with warming the tissue to get familiar with your work area, to find your flow, and to become in tuned with your mechanoreceptors to start feeling some of the deeper fibers within the muscles. From here, we're going to start going into what's known as an isolated myofascial stretch by using my elbow to compress in one direction and my hand to stretch in the opposite direction. We're going to be working towards treating the mid to low back. First starting with warming, find our flow, become in tune with your mechanoreceptors into a sensory compression to find the deeper fibers of strain and tension. And then going into what's known as an all or non-action potential technique by having your client engage their arm while you create resistance. It causes the muscle fibers to contract, increasing the action potential. And when it disengages, the resting potential in the back will occur, and you can follow the muscle as it disengages, utilizing your ability to tune into your mechanoreceptors to feel when the fibers start loosening, to start taking advantage of the vulnerability of the muscles going into resting potential. Once that's completed, we can go back into a isolated myofascial stretch or some deep strokes of the fibers and start warming for the next area. We're going to be working towards the rotator cuff, starting with an sensory compression to find your area, then going into an all or non-action potential. By having your client press their hand against your hand will engage the lower portion of their rotator cuff. The infraspinatus muscle will contract, action potential occurs, and when it comes back down, start manipulating the muscles and finding those fibers that are loosening, or following the fibers that are loosening as it goes into resting potential. Repeating this process 3 to 4 times will help you address the deeper fibers within the muscles. There will be times where some areas are more stubborn than others, so at times you will have to go back to using more superficial, isolated myofascial stretches to manipulate those upper fibers within the muscle before you can use a more in-depth all or non-action potential technique. Once you feel those fibers have somewhat loosened, go back into a sensory compression, into an all or non-action potential technique. Have the muscle engage, create the resistance, action potential occurs, and when it comes back down from contraction, resting potential will happen, and you use your senses, your mechanoreceptor senses, to manipulate the deeper fibers within the muscle. Once that's done, you can start doing a deep myofascial stretch in the deeper fibers of the muscles that you've just addressed. Take your time, move slow, close your eyes, and feel the fibers open up within your hands. start addressing the third and fourth head of trapezius. Have the client engage their arm upward, create the resistance on the back side of the arm. Will help engage the fourth head and third head of the trapezius. Action potential curve, and when it goes into resting potential, manipulate the deeper fibers. Now working towards going into the second head of the trapezius. Use your sensory compression, find your spot, create the action potential, and then manipulate the deeper fibers as it goes into resting potential. Remember to close your eyes and follow the muscle as it disengages. A contraction will occur, the fibers will tighten. Maintain your pressure, and as it disengages, the fibers will loosen and relax underneath your pressure of your compression. And then start manipulating as it goes into its resting potential. Once you're done, flush the area. Now working towards treating the paraspinal of the back or the erector spinae muscles, starting with the right side into the inside of the lamina groove. Start with the sensory compression to find your area. Then have your client slowly engage the opposite leg upward as you create resistance with your hand on the leg. And as the muscle disengages, the resting potential in the back will occur, and manipulate those deeper fibers. Repeat this 3 to 4 times. Create the action potential, follow it on its way down to a resting potential, and start manipulating the deeper fibers using a compression strokes, deep strokes, or isolated myofascial stretches. Now treating the left side, following the same process. Start with the sensory compression, finding your areas of tension and strain. Patience, increase pressure. Have the client engage the opposite leg, create the resistance with your opposite arm, and follow it as it goes into resting potential. And then finish with deeper myofascial or isolated myofascial stretches. Now going into the neck, starting with warming and with isolated myofascial stretches. And from here, what we'll do, we'll use our sensory compression to find your spot, move slowly compress into the area of tension. Then have your client slightly raise their head 1/2 inch, using your palm to create the resistance. As the muscle disengages and goes into resting potential, muscle fibers will loosen, and you can manipulate and follow the fibers as the resting potential occurs. Repeat this process 3 to 4 times. Sensory compression is key for all of these techniques, to slowly work towards a deeper compression. Maintaining firm pressure is key. From here, going into isolated myofascial stretches, compressing the muscle in one direction, and using your opposite hand to stretch it in the opposite direction. Remember to close your eyes, let your mechanoreceptors take over, and take your time. Patience is key. Once we've addressed all of these areas, we will now be able to address inside the scapula or the shoulder blade with some deep compression, some deep strokes to start opening up the fibers inside of the scapula. Flush the area out and do the same procedure on the opposite side. Compression or sensory compression is key with this technique as well. Slowly working towards a firm compression, waiting 5 seconds until you go into a deeper compression. Now going into the front of the neck, start with warming first. From here, doing an isolated myofascial stretch around the fibers of the neck by the collarbone or the clavicle to open up all those congested fibrous layers, all that myofascial congestion. And have your client go into an isolated myofascial stretch. In this case would be an active isolated myofascial stretch. Maintaining firm pressure as the client stretches out those fibers. Now we're going to treat the SEM, starting with an isolated myofascial stretch around the insertions, and then working our way to the attachments. From here, we'll go into an all-in-one action potential with the SEM by having your client slowly engage their neck upward 1/2 inch while maintaining your compression, and then start manipulating when the muscle goes into resting potential. Remember to close your eyes, take your time, allow your mechanoreceptors to take over and find your flow. Now we're going to treat the outside of the neck, starting with an isolated myofascial stretch, using one hand to compress into the neck and the opposite hand to stretch the shoulder to open up those superficial layers on the outside of the neck. When using an all-in-one action potential here, have your client press their head against your forearm, and when resting potential occurs, start manipulating with the opposite hand. Repeat this 3 to 4 times on both sides, and then finish with isolated myofascial stretching and flushing. Isolated myofascial stretch of the second head of the trapezius, and an active isolated myofascial stretch, and then finish with flushing. Repeat on both sides. I want to thank y'all for watching.